Welcome to all of you to SUU's first Forum on Civil Discourse. We are here this evening as a result of a conversation between several members of our Senate leadership. Following an early morning discussion between Dr. Steve Barney and Dr. Bill Hayborn, the following statement was shared in an email to a small group of colleagues. As you are all very much aware, we have a problem societally with civil dialogue that has largely been lost due to loud voices that our current media landscape has been permitted to emerge. This is unhealthy for us as individuals and unhealthy for us as a democracy. We need more civil dialogue and respectful dialogue about so many issues which plague us today. That conversation continued, and as more people joined the email chain, it became clear that our university has a significant role to play in creating time and space for civil dialogue. It has also become clear this is one of the primary purposes of institutions of higher education. As one email noted, before students are in a place from which they can build connections, they need to deepen their ability to practice civility, humility, and empathy. These practices are opposite what we see in unhealthy communities. Too often we are doused with examples of incivility, arrogance, and apathy. So we are here this evening to explore the role of the university in today's society, particularly her role in teaching, modeling, and encouraging civil dialogue about difficult issues. This forum is the first of what will be a biannual event on campus in which we bring people together to learn how to carry on civil dialogue, especially about controversial topics. Often these topics will be filled with political intrigue, moral and ethical issues, and certainly vastly different viewpoints. But we will model how such topics can be discussed and explored with authenticity, candor, honesty, and civility. Dr. Garrett Strasser, Department Chair and Associate Professor of Psychology, described these topics this way. He said, controversial topics are controversial because there is not a unanimous resolve at this time. Although there might be a desire to shy away from such topics and these types of topics, if we people in higher education don't discuss these topics, these challenges will persist much longer than is necessary. This is one role of our education. So our opportunity this evening is to observe a panel discussion in which we will model how people who may be on opposite sides of an issue can speak to each other civilly. I want to be clear that tonight's event is not a debate. In a debate, opposing arguments are put forward with the goal of one idea outliving or dominating the other. The goal of a debate is to win. Debaters spend time looking for holes in their opponent's arguments and exploiting them for their own gain. Civil discourse has a very different goal and a very different outcome. The outcome of civil discourse include empathy and respect. The goal is not to win, but to explore and to understand. In framing the purpose for tonight's event, I reached out to several of our colleagues to help us identify some theoretical approaches that could shape our discussion on civil dialogue this evening. Here are a few of their responses. Dr. Emily Dean, Department Chair and Associate Professor of Anthropology, shared this approach. Anthropologists have long embraced the tenet of cultural relativism, the notion that a culture should not be judged or evaluated according to the values of another culture. We also regularly caution students against the perils of ethnocentrism, the tendency to which one's own culture as best to judge the behavior and beliefs of culturally different people by one's own standard. In other words, we believe that it's best to approach people who are different than you with an open mind and a willingness to understand their perspective and ways of doing things. Curiosity, a willingness to listen and learn, and a non-judgmental attitude usually leads to a greater understanding between people. Dr. Dean continues, the 20th century philosopher Hannah Arendt in Men in Dark Times wrote, however much we are affected by the things of the world, however deeply they may stir and stimulate us, they become human for us only when we can discuss them with our fellows. We humanize what is going on in a world and in ourselves only by speaking of it. And in the course of speaking of it, we learn to be human. End quote. Learning to talk about challenging, terrible, and even controversial topics is an important part of a liberal arts education. She also expressed one caution. She said, finally, I'd be remiss if I didn't mention that some scholars and students have rightfully warned us that civil discourse does not always have a symmetric asks of everyone involved. Calls for civility should not be used as a cudgel to encourage oppressed peoples to politely listen to hateful remarks. The great American writer James Baldwin put it well when he said, we can disagree and still love each other unless your agreement is rooted in my oppression and denial of humanity and my right to exist. Dr. Chris Phillips, department chair and associate professor of philosophy, shared this. Quoting Dr. Marisha Cherry's liberatory dialogue, in liberatory dialogue, another word for civil dialogue, all parties are subjects, talking and listening. As a result, each person is herself taught. No one person does all the teaching, neither can one learn without the other. Both subjects are needed for knowledge, and that knowledge is not found above, but between them. In liberatory dialogue, each person is a critical co-investigator. This makes them jointly responsible for the process in which we all grow. Dr. Maren Hershey, assistant professor of family and human life development, shared this from her field of study. Regarding her book titled Braving the Wilderness, which is about finding belonging in community, Brene Brown, who is a well-known author and researcher on shame and vulnerability, stated this: braving the wilderness is a call to courage, a call to move closer to each other, because people are hard to hate close up. Dr. Hershey continues, this is how we talk about controversial topics in a civil way with others. We move closer. We work hard to see people who view things differently than us as people. Our current society has gotten away and gotten very good at viewing others more as a barrier or other kind of object than as people. When we work to see people as people, we naturally view them with empathy and compassion, which builds our understanding. So within this framework, tonight we get the opportunity to model and to teach what it means to have civil dialogue, especially with those who see the world different than us. Within this framework, we are also here this evening to celebrate the role of Southern Utah University in promoting, teaching, and modeling civil dialogue. It is now our opportunity to invite to the stage Dr. Bill Hayborn, who will introduce our panelists and our topic for SUU's first forum on civil dialogue. Dr. Hayborn.
Good evening. It's a pleasure to see an audience out there. It was getting close to the hour and there were very few people here, so we're glad that you decided to join us. Hopefully there are some folks online as well. It's my pleasure to serve as the moderator for this discussion this evening. I appreciate Provost Anderson and his opening comments and framing what we hope to accomplish here this evening. Before I invite our panelists up onto the stage, I thought it would be useful to describe briefly some of the components of civil dialogue, civil discourse, so that as you are participating here this evening and watching this discussion, you can be on the lookout for particular behaviors or particular ways of behaving or interacting that are hallmarks of the civil discourse process. So let me run through these items with you. These were gleaned from a number of resources, so I'm not going to cite sources here tonight, It's kind of my own list that I put together after reading a number of online sources. So there are, in my opinion here, in my reading, there are 6 main ideas or tenets of civil dialogue, civil discourse, and I'd like to share those with you now. Number 1, folks engaged in civil dialogue use appropriate behaviors and body language. It's noted that we should avoid eye rolling, sighing, laughing, and other demeaning behaviors. Things we should do is make eye contact, pay close attention to the conversation, and use welcoming and inclusive gestures. Number 2, only speak in turn. Do not interrupt the other speakers. If the conversation is being moderated, wait to be called on by the moderator. Also, don't engage in side conversations. Number 3, follow the direction of the discussion. Don't repeat what has already been said or derail the conversation with off-topic information or opinions. Number 4, differentiate between facts and opinions when you are speaking. While both have their place in civil discourse, be clear about when you are expressing your own opinion. Number 5, be a careful listener. This will help ensure that you stay on topic. Listen for what other speakers are trying to convey, even if they are not doing so clearly. Ask clarifying questions when necessary. And number 6, find common ground. It's easier to keep the conversation civil when each participant is on the lookout for areas of agreement. So I would encourage you, as you are watching the conversation unfold tonight, to look for those 6 components of civil dialogue. I'll do my best as the moderator to help point some of those out as we engage in the conversation as well. So at this point, I would like to invite our panel to the stage. So panelists, come on up here. And once they take their seat, I'll introduce them so you have a little bit of a background regarding these folks and where they're coming to us from here on campus. Excellent. So beginning on your left, on my right, at the far end of the stage, we have Mark Seaman, Assistant Professor of Nursing. Next to Professor Seaman, we have Professor Roger Gold, Associate Professor of Biology. Next, we have Professor Maren Hershey, Assistant Professor of Family Life and Human Development. And next to her, Shauna Mendini, Dean of the College of Performing and Visual Arts. Next to Shauna, we have Mary Bennett, Director of the Levitt Center for Politics and Public Service. Next is Matthew Eddy, Associate Professor of Associate Professor of Sociology. And last but not least, Katie Hill, Lecturer from the Department of Economics. Let's begin with a round of applause for our panelists tonight. Our topic of conversation tonight is COVID. But particularly, the question of interest and the topic for our conversation is, given where we are at this point in our history, our shared history with the COVID-19 pandemic, how do we move forward? And we've specifically reached out to these 7 individuals because they represent different disciplinary perspectives, have different disciplinary expertise that will allow for an interesting and hopefully lively dialogue regarding how to move forward given our place in the COVID-19 pandemic. Before I turn the time over to our panelists, we thought it would be useful for us to begin our conversation this evening with some facts, some things that hopefully all of the panelists can agree upon in terms of where we are with the COVID-19 pandemic. So let me share a few of these with you at this point. According to the National Center for Health Statistics, this is an agency administered by the CDC, and Johns Hopkins Coronavirus Resource Center, Worldwide, there have been more than 248 million confirmed cases of COVID-19. And as of this week, just over 5 million deaths, which have been attributable to the virus. According to Johns Hopkins, the same two agencies, so again, Johns Hopkins and the National Center for Health Statistics in the United States, there have been more than 46 million confirmed cases of COVID-19 and just over 750,000 individuals who have died of complications attributable to COVID-19. It should be pointed out that these are individuals that had COVID-19 listed as the cause of death on their death certificate. According to coronavirus.utah.gov, a little closer to home here in our state, there have been over 550,000 confirmed cases and 3,262 deaths as of this afternoon. Economically, the COVID-19 global recession is the deepest since the end of World War II. And in a report from the Brookings Institute, they write that the global economy contracted by 3.5% in 2020, according to the April 2021 World Economic Outlook report published by the International Monetary Fund. And this is actually a 7% loss relative to the 3.4% growth that was forecast back in October of 2019. And while virtually every country covered by the IMF posted negative growth in 2020, the downturn was more pronounced in the poorest parts of the world. And then lastly, while the impacts of the pandemic on our collective psychological well-being are more difficult to quantify, I think virtually everyone would agree that the effects have been overwhelmingly negative. So again, with those basic facts at our feet here this evening, our question for the panel at this time is, given your disciplinary perspective, how should we move forward from here? And we've asked each of our panelists to begin our discussion this evening by providing a 3 to 5 minute statement regarding how we should move forward from this point in time. So let's just begin down on the left with Professor Seaman, and we'll move along toward me across the stage, and we'll allow each panelist to provide their perspective. Professor Seaman.
This virus, while we've done a good job, I think an excellent job of vaccinating and developing a vaccine, a very effective vaccine, a very safe vaccine, we still have less than 60% of our population here vaccinated. Globally, I think it's probably less than 2% in some countries. And this virus will mutate. It may get worse, it may not, but we're going to be living with this virus for a number of years to come. It will probably become, if we look at the best projections, and I'll let Dr. Gold talk about most of those, but will become endemic, similar to influenza. We'll continue to see, depending upon the projections you look at, in the tens of thousands of deaths every year. Again, until we get enough immunity, either natural immunity or vaccination derived immunity. And it's really what my concerns are in the future is the impact that it's had on our healthcare systems and our healthcare workers. From a public health perspective, this has been a complete failure. And some of the measures that we had hoped, the non-pharmaceutical measures that we were trying to take early on in the pandemic, asking people to stay at home, socially distance, physically distance, wear masks in public. We adhered to those fairly well early on, but then we began to let some of our guard down. We began to hear disbelief about the virus, how lethal it was, how infectious it was, how effective masks were. And a lot of that, I think, again, can be laid on the part of our public health infrastructure and poor communication. I think the biggest issue right now for me and moving forward is how do we improve communication around this and other threats to the public? And that, hopefully this will be the start of that. And how do we, again, have these civil dialogues where we can agree, as Bill said, on the facts, and then think about how can we think about a path forward that we can keep everybody safe? Because when it gets down to it, public health is designed to keep the public healthy, to keep people healthy, to prevent disease. And the measures that we take may infringe on people's individual liberty. There's a constant, again, conflict between the ability of public health to protect the public and individuals to, again, make their own choices around wearing a mask, getting a vaccine. And it always has to be, from a public health perspective, proportional. We're asking people to do something to protect others in their community. And that, I think, again, is part of being a good civic member of society. And some people will do that. Other people maybe need a little bit more encouragement. But how do we, again, begin to communicate the message that it's not just about your individual choice. It's also about, when we're talking about an airborne virus that can be easily transmitted, about protecting those most vulnerable in our community, the essential workers, the doctors, the nurses, the ambulance, paramedics and EMTs, the people serving you in the restaurants and the grocery stores. How do we protect them as well so that we can, again, keep our society open and, again, not totally ruin our economy? So I'm hoping as we move forward, we can begin to have these discussions and begin to think about the next pandemic, because there will be another pandemic, and the next global health crisis. And then we can also, again, think about how do we, again, ensure that other places in the world also receive the vaccine so that we are also safe as well. So I'll stop there.
Thanks, Professor Seaman. Dr. Gold.
So I'm a researcher, and I've been teaching courses in microbiology and immunology for at least 15 years. At the beginning of the semester, I had a conversation with my students on that first day. And I told them the reasons why I wear a mask. I told them, basically, I asked them to wear a mask as well. First, I could see there was some eye rolling going on. But once I explained to them that I'm very concerned about my elderly parents who I take care of, that I'm of the age and I have some pre-existing conditions that I'm concerned, they each agreed to wear masks in the class. And I was very thankful for that. One student said, I'm very much against wearing masks, but out of respect for you, Dr. Gold, I will wear a mask in your class. And again, I very much appreciated that sentiment, but to be honest, it concerned me a little bit. So one of our first assignments in the class was I had students look up papers, research papers dealing with the effectiveness of face masks and vaccines. They had to find those papers, read them, understand them, and summarize them. And then we talked about the principles they learned. Everything sounded great. After all this was done, I did a little anonymous survey, and I asked students about their vaccination and face mask behaviors. Something like 59% of my students, most of whom are planning to go into the medical field, said that they don't wear masks in any of their other classes. 48% reported that they had not been vaccinated. And of those, 20% said they had no intention to be vaccinated. So somehow, even looking at the data didn't translate to a change in their mind, a change in their behavior. And that was concerning. That's scary to me. It almost sounds like a physician who refuses to wash their hands. I'm frightened by those numbers a little bit. And again, we're being bombarded with just harmful anti-science messages from our politicians, from social media, from news networks and so forth, so that even when we share the facts with people, they're not seeing those facts. They will answer the test questions appropriately, but they're not changing their way of thinking, not changing their behavior. And again, that frightens me. And so I've been really struggling as a teacher with the question that we're here to discuss today. How do we go forward in this environment? And I think sometimes it helps to look back to figure out how to go forward. And I was thinking about the polio, the campaign to eradicate polio back in the 1950s. There were some differences. We in the United States mounted just a massive campaign against polio. People lined up in droves to receive the vaccine. Vaccination rates, in fact, were so high, polio was basically eradicated in our country. Even though travelers occasionally brought the disease back from other countries to the United States, there were no domestic cases of spreading of the virus for the last 40 years in this country. And as a result of these vaccination efforts, just millions of lives have been saved, incredible amounts of suffering and economic hardship have been avoided. Just kind of looking at what made that event, that campaign successful? One, they recognized that polio was a serious problem. They saw people who had polio. They recognized that it was an issue, okay? There wasn't any of this denying that it even exists. Second, people understood, respected, and trusted the science. They recognized that the people who've dedicated their lives to studying viruses and vaccines know what they're talking about. And they're willing to take their word over the social media influencers, things like that. Third, there was just a strong and coordinated focus on vaccine education. The government was really trying to, and volunteers were going out and trying to teach people the benefits, the promises of vaccine, how they work and how effective they can be. Fourth, leaders and even celebrities, Marilyn Monroe, Sammy Davis Jr. There's a good picture of Elvis getting the shot. They were portrayed on the radio, on television, on posters everywhere. And the common message was, please, everybody, get vaccinated. And I think probably the most important factor was the country was unified. The strong, consistent message was, we're all in this together. People understood that their own actions would impact others around them, and they cared. They wanted to do something to protect their families, their friends, their neighbors, and their communities. It's sad to see that the flames of division and discord are being just constantly stoked by people today. Social media influencers are just trying to make a name for themselves any way they can by licking toilet seats. I don't know what's up with that. News media is short-sighted politicians and so forth. We need to get away from that. And somehow we have to take a stand that takes us back to kind of what we saw in the 1950s. We need to be the ones to take leadership on this. We've got to recognize we all have biases, and we have to be willing to set those biases aside. We need to be willing to look at actual scientific data, to read the research, to honestly try to understand how scientific studies are done and why they matter. We have to stop arguing about differing opinions and start focusing on facts. We have to recognize that our words and our actions really do have real consequences on other people. We have to accept that each one of us has a responsibility to protect the people around us. We have to care enough for others to do the simple things. Wearing a mask is a very simple thing that has been shown time and time again to effectively prevent the spread of the virus. Being vaccinated is a simple thing we can do that's not only about me, but it's protecting the vulnerable people around me. We have to set the example. I think we have to educate people within our sphere of influence, and we need to hold our politicians accountable. We need to make sure that we're voting into office those who trust the science, who are making decisions based on known facts and the science. And again, I just really believe that if we grab hold of that message, they're all in this together, we can get over this thing. We can make some progress against it. It's probably too late to eradicate it based on people's responses, but we can get ahead of this. But if we don't, we are going to see more and more dangerous variants arise, and we're going to continue to see a lot of suffering and the needless loss of life.
Thanks, Dr. Cole.
Hello, thank you for having me. My background is as a social worker. I'm a licensed clinical social worker. I have worked both within the mental health population as well as in the medical setting. And as I've thought about how to move forward from a mental health perspective, there are three things that come to my mind. The first is empathy. The second is honesty. And the third is understanding individual perceptions. Is it back?
You're there.
Okay, excellent. So first, we need to understand empathy from all angles of this issue. Empathy, so the opposite of empathy is sympathy. Sympathy is about disconnection. It is what drives, it's where we go when for whatever reason, we can't stand to connect with another person. And it's almost always, if not always, about our own discomfort and our own issues that are getting in the way of our ability to connect with other people. Empathy is when we make an intentional effort to connect with other people. So the probably the biggest telltale sign of sympathy is our comments such as, well, at least, or trying to make a situation better. There's usually nothing that we can say that will make a situation better for someone else. Empathy is when we work hard to relate and connect with what the other person is experiencing. We don't have to have experienced the very same thing as somebody else. We don't have to agree with anyone else. All we have to do is to be able to understand their perspective and be able to connect with whatever experience and emotion they're describing to us. So the reason empathy is important for this is we have to remember, if we're ever going to get anywhere, we have to remember that every single individual has their own perspective and experience for a reason. So folks who are against vaccination have a reason for being against vaccinations. Doesn't mean they are or aren't correct. It just means that they have a reason for their perspective. The same is true for folks who are supportive of vaccinations. Doesn't mean they are or aren't correct, although the science indicates vaccinations are effective. We just need to remember that everybody has a reason for their perspective. The second point, honesty, is a much, much more difficult issue. And we have to be honest with ourselves, and we have to, as you said, we have to hold our politicians and our leaders accountable for their honesty or lack of honesty. When folks who are in leadership and authority positions are dishonest about things, we feel crazy when we trust the hard science. One example of this is legislation making mask mandates illegal. That sends a loud message that the science is incorrect. And for those who trust the science, we begin to feel crazy. We begin to feel like something is wrong with us. There's a term for this in the psychological world, which is called gaslighting. And it is when somebody else behaves or responds towards us in a way that makes us question our own perception of reality. And it's very harmful and very damaging, which I think we can see in our society, that lack of honesty from our leaders and folks in places of authority has been very damaging for our society. The third thing we need to remember is that individual perspective. From the place of moving forward with this, individual perspective is at least as important as the hard science and the hard data, because our perception, our individual perception, is our reality. So for the folks who I've heard of many scenarios of individuals being intubated in ICU intensive care units in the hospitals, and they are very angry that the diagnosis is COVID. They're very angry that their loved one is being intubated because their perspective is that their perception is that COVID is not real. So perception, the reason that perception is such an important thing to consider and keep in mind is because our brains respond to perception much larger, much bigger, and more quickly than our brains respond to reality. So if we want to get ahead of this and we want to resolve this issue, we have to work in a very honest way of addressing individual perceptions of the virus and its impact on our society, which includes things like, it includes holding folks in authority accountable for the hard science. And it includes people who have power making honest decisions and approaching this from an honest perspective. That's all I got.
Great, thank you.
Wonderful.
Dean Mendini.
That was wonderful. Thank you. There was a big experiment that went on this summer, and it was pushing boundaries within strong protocol. And that was the Utah Shakespeare Festival going forward with 8 full productions, 5 of which were indoors. We are an equity house. We are an equity theater, the Utah Shakespeare Festival, and I hope you all know they're part of Southern Utah University. They're an equity theater. So in order to get a contract, you have to work through a union. And the unions are in New York. New York was not worried about Cedar City, Utah. They didn't even care about Cedar City, Utah. They were caring about Broadway. If Broadway wasn't opening, nobody's opening. And after multiple opportunities of putting forward a safety protocol, our wonderful leadership with the Utah Shakespeare Festival got approval in the 11th hour to go ahead and cast equity actors. Now, when they came here after a darkness of 2020 into a grayness of 21, they realized that we get to work. We get to do what we love to do. We have an opportunity to create for an audience a catharsis experience that they definitely need now more than ever. So the opportunity for these artists to come, that is our actors, directors, crews, to come here to Cedar City and do over 300 performances, they had to toe the line. They had to live in a bubble, wear masks at all times except for on stage. Backstage, they had to wear masks. If we were to enter the bubble, everyone had to be vaccinated. It was part of the union experience. Everyone had to be vaccinated. If you worked for the organization and you chose not to be vaccinated, it didn't stop you from being employed or being engaged. You just had to work remotely. It's what had to happen to make that move forward. Now, what's happened with that experience is it was a tremendous success. A tremendous success based on the commitment and the sacrifice and the knowledge of individuals coming together to say, this is what we have to do in order to do that, this or that. And they did it. They had no performances canceled other than, remember the smog, all the smoke last summer from the fires? That canceled 2 performances because you couldn't breathe and all that. And then we had rain, but none for COVID because of protocol, because of respect and respect for each other and the opportunity to move forward. So moving forward, I have this great model now with the Utah Shakespeare Festival being successful. So what do I do with my own students that are performing? Well, we've been approved to get testing for those students for every performance they do. They're tested every week so that they can do what they love to do. They wear masks. Chances are the students that you see around campus that are wearing masks, most of them from my college, they know they have to do that. They have to do it in order to be on stage. And also the ability to say, okay, in order to do this, we got to do that. And so it's been an incredible adventure. We're in the middle of this. It's not over. And we have to make changes as we move forward. It's not the same as it's always been, but we can still see the lightness. Lights on stage can still come up. Museum doors can still open. It's just we have to do it a little differently.
Thanks, Dean Mendini. Mary.
Hello. So I am with the Center for Politics and Public Service. And so I'm going to talk about where we are today and what we might do going forward. And I'm going to speak about it from the perspective of a public servant or an elected official. And this set of people is in a wholly unique and unprecedented set of challenges. In times of crisis, whether it's war or pandemic, people look to their government as a source, and they look to their leaders for guidance. The problem is no one has ever been through this in our lifetimes. No one has worked it before or dealt with it before. And no one has ever seen 750,000 Americans die within 2 years. So this is an order of magnitude larger than anything any public servant has ever seen or worked with in the United States. We've never seen our public health systems get so overwhelmed and resources become so scarce. That's another concern for a public servant, the hospitals and the resources for healthcare workers and for runs on grocery stores and the absence of PPE and rationing that and all of the crises of supply chain, that it was all new to every public servant in the country. And no one, the local, state, federal governments, no one, except I will allow for some exceptions, but not that I know of, but had a clear, up-to-date plan on the shelf about, okay, this happens, we do this, we do this, we do this. And this is how we communicate with people. And this is how we are consistent in our communication. Well, that didn't happen. And people who were public servants or elected officials were unprepared for it. And so what you saw was in every state, there's a different set of rules. And in every school district, in every locality, there's different rules. And that creates confusion. And people aren't sure who's right and who's wrong and how should it be and how shouldn't it be. And so a lot of times elected officials are in a jam. They're caught between what different people say and different interests want and what's good for business versus what's good for schools. And it's a very untenable position for any a public servant to be in. And so you have all of your elected officials with no experience. You have a fast moving crisis with life or death results. And so what you have is a situation where the absolute lowest level of experience meets the absolute highest stakes of life and death. And that is what we've been through. And it's devastating, right, to the country and to how we feel as a nation. It also means that public officials are always responding to things as they happen. You can't get ahead of it. You're acting on your best judgments on the fly, and you probably aren't always getting it right. And so mistakes are made. And the communication isn't there. Again, all of the citizens are saying, I don't know who's up, who's down, and people are dying, and my aunt is sick, and it's chaos and life and death. So you couple this with already Americans had very low confidence in our public institutions. Add that on top of all of this other stuff. And the recent numbers from the Pew Research Center, 24% of Americans say they trust the federal government to do what is right about always or some of the time, always or most of the time. So that's 24% of people who are going to listen to what the government says and believe it. And so that was how it was before. It's the same rate now. So this experience didn't tank it further. but didn't raise confidence either. And so the low confidence stays throughout this crisis. And then the other thing that so many public servants haven't had to do is to face the stark moral questions that this has brought. People are used to arguing about roads and bridges and taxes and healthcare. And here we are, we have representatives, elected representatives, thinking about choices like, do I represent a majority of what my constituents want me to do? Or do I make another choice that I believe is for the greater good? And it's a real tough call, calls for bravery and courage of every one of those elected officials. And they've probably never really been put in that situation before. And as we know, some rise to the challenge and some don't, just like everybody else in any population. So with that said, what public officials you're having three crises that I can identify that our governments are facing now. One is the spread of the virus. It's a rapidly spreading virus. It's deadly. And the new variants are going to keep renewing this condition. And so you're on practically a crisis treadmill because it keeps coming and people keep getting sick. And as we heard earlier, it's not going to go away. We hope it lessens, but you're on a treadmill of trying to manage it. The second crisis would be the economic downturn and its aftermath. Businesses closing, people losing jobs, people not being able to pay their mortgage or their rent. The economic recession we had, 7%, huge effects everywhere you look and in every city and town in this country. That is something a public official, people look to them to try to help with money, with business incentives, with tax breaks. I mean, all kinds of things you now have to consider to try to get the economy back on track. And then the third crisis we just got, which is labor shortage and supply chain issues. And so all these businesses who now are trying to get back in business and rolling can't, because they can't get what they need to have their business. And that issue is global. We can't just solve it in the United States. It's got to be a global solution that will take time. And we're told now that the supply chain crisis will continue into 2023. So it's kind of an insurmountable task for a public official to stop and think about all of these things. What do I do first? Where do I go? There's nobody who can tell me what I should do because nobody else knows either. And so I feel public servants have really taken it on the chin, and oftentimes it's deserved. I do think that this situation has really pointed up some of the heroes and some of the flaws in our system that might help make things work better. So some of the thoughts on moving forward, and they're a little bit more practical, but we need to make sure that our governments pay attention to developing the capacities of public servants and elected officials. Let's have the capacity in our local, in our state, and our federal to identify possible threats and have a plan to act on them and work on emergency preparedness and quick response and communication. And I think we all know now those are things we need to prioritize. So we need to have those programs, but we also need to train people who are elected on how to run them and what they mean and what they stand for. Learning from successful practices and mistakes, I think that's probably a given. And sustained development of responsible, responsive, accountable, and people-focused leadership in public sector institutions. And I think that's pretty profound. We know a lot of people get put into public office, but they don't necessarily have leadership training, and a new way of thinking about how do you become people-focused and people-centered, and how do you, instead of thinking about laws and bills, how do you work with your population to take care of them, and so that they can trust you and you can build confidence in the government. And then the last one I have is to provide financial resources for pandemics and other crises, floods, fires, before they happen. And this would be the time now, after we've gone through this and we have time to look back and assess what went wrong, what went right, what do we need, what do we don't need. We should now be able to see and prioritize. Every locality needs to have some funding dedicated to the mitigation of catastrophic events.
Great, thanks, Mary. Professor Eddie.
So I'm going here near the end, and some professors took my ammunition here a little bit.
I saw you frantically taking notes. Good job.
So I won't have to repeat some of the good points that were already made. How do we move forward? I'll just briefly suggest scientific literacy is one of the things that's crucial. It's been said that we're living in the golden age of junk science. There's a lot of dimensions to that. You've got the megaphone effect of social media. We can't expect everyone to be scientifically literate, however, so we have to have an element of trust for our experts. And the lack of trust in experts, as my colleague was pointing out, or trust in government, has been a storm that's been brewing for many decades. We've lost our trust in mainstream institutions, mainstream media, government, and that's been brewing for decades. The sociologist Barry Glasser wrote a book, The Culture of Fear, where he talks about how in the United States, we're often afraid of the wrong things. There's a lot of reasons for that. It's, fear is somewhat irrational, but for example, back in the mid-1980s, there was the DPT vaccine, which the component of it for whooping cough was, there was kind of a hysteria around it. And it grew out of a news media push that went out and found people who thought the vaccine had harmed their child. It turned out that this was all bogus, but it took a while to sort that all out because the media went and found anecdotes. So it was the triumph of anecdotes over science. And Congress actually stepped in a little bit and played a role in trying to educate people about the safety of the vaccine. And they were largely successful at that time. Of course, we're seeing also the triumph of politics over science today, whether that's local politics, like literally at the county level or the state level. We're just seeing a lot of politicization of this. I mean, who would have thought that you could politicize a virus? Who would have thought that? I mean, another thing as a sociologist I think about is just media literacy, as well as information literacy more generally. So for example, as I teach my students, we've got basically 95% of the news media landscape controlled by 5 corporations. You have to read the media intelligently. You have to read it critically. And one of the tricks, sometimes, it doesn't work all the time, but one of the theories is follow the money. Follow the money. The corporations and the news media rely on advertising. They're often dependent on the good graces of corporations for their budgets and so forth. So just to give you one example here, and I think this is one of the untold stories of the pandemic so far. There is a conflict of interest with some of these misinformation outlets. And this was brought up in the Washington Post a few weeks ago. So we've got some networks of far-right doctors who have come together to form a group, America's Frontline Doctors, and they have made millions of dollars off of prescribing hydroxychloroquine, and ivermectin. Millions of dollars, tens of millions, actually. They also do $90 consultations with people through telemed, making hundreds of thousands of dollars a day doing this. And they have not only spread doubt about the vaccine, but spread quack science about these remedies that actually are proven not to work. So what do we do about that? We've got to beef up our regulatory mechanisms. So this group called No License for Disinformation, who wrote a piece in the Washington Post, that we got to take licenses away from these medical doctors. And this will have to be done at a state level. But we have not invested sufficiently in state medical boards for a long time. So for example, California gets 10,000 complaints a year. They only have capacity to deal with 1,000. And it takes them a year and a half to deal with that, each complaint on average. We have got to regulate this new environment of disinformation. We have got to crack down on it. As a sociologist, I would emphasize that social norms are contagious. They're highly contagious. Even attitudes. We have really good data that happiness is actually contagious. Most people are embedded in in a network of 150 people in a local environment on average. If someone in your network becomes happy, if they're 3 degrees of separation away from you, you're like 15% more likely to become happy for yourself, just because you are connected to that person. Social norms are highly contagious. We know running is contagious as a behavior, running. If you have a friend that runs, you're more likely to run yourself. And it's not because you had that hobby first and then you fell into friendship. It's because you were influenced by other people in your network. So it's absolutely obvious that mask wearing and attitudes towards vaccine is so socially contagious, and it spreads through social networks, local networks of friends and acquaintances and family. In terms of thinking about building trust in our mainstream institutions, I would just flag or recommend Michael Lewis, who's a very accessible journalist who wrote Moneyball and The Big Short, got made into Hollywood films. He's got 2 books about government bureaucracy. One of them is about the CDC. And he just shows you, page after page, how we depend on government bureaucracies to do good work for us and to relate their jobs to science. The CDC has been hampered by political appointments and other bureaucratic challenges, but a lot of those political appointments have conflicts of interest, where they come out of big pharmaceutical backgrounds and so forth and so on. So anyway, Michael Lewis has 2 really good books on government bureaucracies and the important things that they do to keep us safe, like the FDA and the CDC, but they've been hampered in recent years by underfunding and political appointments. Just a few more points here. Most people are, in my opinion, doing the right thing. According to Pew Research, 60% of Republicans have got at least 1 vaccine dose, and 86% of Democrats have got at least 1 vaccine dose as of August. But the minority are very, very noisy and very afraid. And so that's where we are. In terms of demographic groups, white evangelical Christians, and I have many family who are that, they're the highest really demographic group that you can find in terms of resisting vaccines, 57% of them, and 80% of them say they don't trust the science. So it's about trust in science in part. I do think we have to think about preventing the next pandemic. We know that this is partly an environmental crisis. So we've got a number of diseases that have spread from wildlife to humans. They've jumped species, right? So we've got, and it's becoming more numerous. So we've got bird flu, swine flu, Ebola, SARS, and many of these actually hit Asia harder than here. And so Asia was prepared. They had some dress rehearsals for this. I actually think one of the best comparisons in terms of international comparisons is Japan. Japan was a lot like us, except for one thing. 95% of them are willing to wear a mask. They were a lot like us on a lot of different dimensions. They prioritized the economy. They didn't shut down the bars and restaurants. Anyway, that was the one thing that was different. And the New York Times argued that earlier this year, that if you had a public willing to do that, it would have helped us a lot. Let's just one more minute here. The Bill Gates Foundation, because we have disinvested in our public institutions and bureaucracies like the CDC, but also the World Health Organization, it gave space for Bill Gates to kind of rush in and really kind of have an outsized influence on some early decisions. So Cambridge University, you might remember, was developing a vaccine, and they were really fast on this. And Bill Gates rushed in, and he had some leverage with them because he'd given them millions of dollars. And he talked them out of moving their vaccine to an open license arrangement, which probably would have helped the whole world fight the vaccine better, especially poor countries. And so there's a problem when you've got private organizations that don't have democratic oversight, they don't have democratic input, they're very private. And you know, as smart as Bill Gates is, I think he's got some blind spots. Personally, I think the open license would have probably been a better way to go. And some experts agree with me on that. I mean, I'm reading experts when I say that. But we really failed as a country. The Lowy Institute said that the best responses by governments as of January of this year was New Zealand was #1, Vietnam #2, Taiwan #3, US was 94th, and Brazil was 98th. We could have done better. Now we've got some challenges. We have more obesity, we have more heart disease, we have more elderly people than some of the other countries around the world. So we've got a lot of complicated things going on here, but last thing I'll say is it is partly a crisis of empathy. We know from research that people are kind of callous when they think about this pandemic because they know it impacts the elderly more, and somehow people have less empathy for the elderly. Also, we know this pandemic has had an outsized impact on the poor and racial and ethnic minorities. And you know, it doesn't have to be politicized. For example, in Germany, mask wearing is not politicized. Doesn't matter if you're conservative or liberal, they embrace mask wearing in certain crowded indoors settings. Denmark has 99% of people over 50 vaccinated, and 99%, and all of their adults, 90% of them are vaccinated. So they went back to normal. There's a little bit of a rise because even when you have 10% of adults who are not vaccinated, that can be a problem, and you get high hospitalization rates. I'll leave it there for now.
Thanks, Professor Eddy. All right, last but not least, Professor Hill.
All right, so as my colleagues here have mentioned, a lot of this is going to be kind of built off ideas they've already talked about, but I want to talk a little bit about Utah specifically and the economy here in terms of what happened during COVID and how we're starting to recover. First off, Utah did fare a lot better than many other states, many other locations. I think a lot of this was due to the fact that we really had a strong economy at the start. We were 4th in the nation for the lowest unemployment, and we were actually tied at our lowest unemployment ever before the pandemic hit. So that's a strong start itself. We also had the second highest GDP when we started, which, if you're not familiar, GDP is basically a measure of our production and our value. So we really did have a very strong growing economy to start. And that really helped us not hit the lows of the pandemic that some other locations hit. We did, though, however, hit some serious issues in terms of the service, hospitality, leisure industries. We live in an area where going to national parks, taking like small trips, all those little hotels in all these different areas, they were hit significantly hard when travel basically was abruptly stopped. Thankfully, we did not get hit as hard as Nevada. Nevada took a very, very, very hard hit in terms of the hospitality industry, but we still did have a lot of issues with that. One being the national parks shut down for quite some time. However, we did open up our state parks earlier than our national parks, and you can tell by the attendance that a lot of people flocked to those areas when those opened, rather than going to the national parks since they were not available at the time. Utah also has the benefit of a lot of the tourists here come by car, or even if they come by plane, they're still usually domestic. We do get our share of international tourists, but primarily domestic tourists led us to still have some input from tourists. And we actually saw a big influx of people from like California and Nevada. I remember back early on, and when COVID hit, there was a big tournament of baseball or softball in St. George where teams from all over the West came because we were open and they were not. So it was something that they had available to them. With this leisure and hospitality industry, though, a lot of the service type jobs were either cut or reduced significantly. This is very different from previous recessions we faced, which have been primarily on like good-based declines. So this was a really interesting one when we looked at the patterns that in like the Great Recession back in 2008, purchasing went down significantly. However, the service industries were not as severely impacted by it. So this was a really unique scenario. With this recession, and I'll call it a recession, one of the biggest issues is that the lowest paid workers were hit the hardest by far. These workers were often not people who could transition to working at home. They may not have had the skills to transition into other jobs. They often had to deplete their savings and bank accounts, just trying to stay afloat, whether that be keeping their mortgage, things like that running. On the other end, our high income or higher income people tended to fare actually pretty well because these people often had jobs they could transition and work from home. So they had continuous employment, so not really a loss of income. And they actually ended up having higher savings rates because they were not out spending money. And that to me was a really interesting scenario where the low paid workers were really hard hit and the mid to higher income people who could work from home, they actually ended up doing just fine, actually having more savings. So as we continue forward from this global pandemic, we need to keep that in mind that these lower income people, they were significantly impacted by this. And we do expect some uneven recovery in terms of economic growth because the high income are still doing all right. They have savings, they'll be pretty steady, but those lower income people are going to struggle a lot more to get back on their feet and get moving. Another thing that was just brought up, the impact on women and people of color. So women have had a huge drop in the workforce, way more than men. This is attributed to the fact that either they worked more in industries like the leisure, in service, or education industries where jobs were cut, but also they often stayed home to take care of their families, to keep their families safe. Young children were not going to school there for a while, so someone had to watch elementary age children, and often that fell on the woman, the mother. And so that has kept these women often out of the workforce, and they are not finding their way back to the workforce as quickly as we would like. Typically, and historically, men have bared a lot of the burden of layoffs. So I'm from the Detroit, Michigan area. And when the recession hit and all of the car industries and things like that, they left. A lot of those were jobs that males held, more production type jobs. And so traditionally males bear the burden of layoffs, but this pandemic has shown to be different in that sense. Like I said, women are just not coming back to the workforce in the level we would expect. Another thing I want to keep in mind is that the shortage of workers that we're facing, you can probably go just about any business and you can see we are hiring. The pandemic has led us to some interesting scenarios in that there are still people out there that are unemployed and there are workers in places that are hiring. A lot of it has to do with skill mismatch. Maybe they're not qualified for said jobs. Maybe they need more education and training. But the pandemic has actually allowed people to step back and think about what they value in their life. And for a lot of people, that's time with their family. They want more flexible jobs, maybe higher paying, maybe more benefits, but they found these other pieces of their life that were really important to them. And so when they're looking at jobs now, they don't necessarily jump on the first job they see because they want something that fits their lifestyle. But in terms of hiring workers, I'm sure a lot of you have noticed that wages have gone up in locations. Walmart's been a big driver of that. Trying to get workers to come, trying to incentivize them, giving them these incentives to come back to work will be really important. As we move forward, there's a couple things that I think are really important that we keep in mind. First off, to keep businesses open, we have to keep health risks down. Ignoring government restrictions, if we cannot stay healthy, if we cannot stay safe, businesses will not be able to stay open. So as everyone's kind of talked about, being vaccinated, wearing masks, social distancing, staying home if you're sick, these things can really, really help drive a healthy economy because it allows businesses to stay open and stay functioning. If you're working for a company and half of your workers call in sick, that is not going to be helpful. Another thing we should note is that there's been a huge shift to remote or virtual work. Some have shifted now back or are shifting back to office work, but because it's kind of been shown now that we can work from home, we can be just as productive as we are in an office for the most part. These workers are wanting that flexibility. So some workers are fine going back to the office. Some workers would rather stay home, and businesses are going to have to adjust to that. Businesses that offer that flexibility may entice more workers than those that don't. Those other workers don't have to spend time commuting. They don't have to necessarily maybe be distracted by others. There's a lot of other benefits from working from home, being able to spend more time at home with their families and spend more time doing household chores like cooking and cleaning because they're not spending hours commuting. This will be really important as we continue because now that we've kind of shown we can do this virtually, it's going to be really hard to convince workers that you absolutely have to come back to the office. Another thing that we can see and expect to continue is e-commerce. In terms of purchasing things on the internet, that's been growing for many years, but it exploded at a rate we didn't even think was possible. If you've ordered anything from Amazon or other companies lately, you'll notice that 2-day shipping may not be 2-day shipping right now. One, because of worker shortages, but two, they are just overloaded with demand. And so that is something you can expect to increase. If you are a business owner, having a website, having an internet presence is going to be critical. Being able to order and deliver online will be super important because that is what your customers are going to start expecting. Also, things like telemedicine, that's expected to continue. Virtual healthcare, there's lots of contingencies with that in the medical field and who can treat who across state lines and things like that. Insurance coverage has been questionable, but it's been expected and predicted by some senior economists that that is something that's going to likely stick around. And that can actually really benefit people in rural areas like Cedar City because you may have access to maybe more specific specialists or higher end doctors that you wouldn't necessarily be able to go see because we are kind of in a rural area. Another thing we need to work on, or another two things, I'll end with these, is first, childcare costs. Again, women are not coming back to the workforce at the level we would like. And this can be really critical, not only for this period of their life, but for the rest. They call these kind of the key earning years. And if they have to stay home with their families because they can't even afford to work, they're missing out on that experience. There's nothing wrong with choosing that, but there are some families being forced into that. There are families that if they went to work and had to find childcare, it would cost them more in childcare than going to work. That is not going to make sense for them. So if we can help reduce childcare costs, maybe through government subsidization or other things like that, we could help encourage women to come back to the workforce. Another thing we need to address is either equal access to high-speed internet or other infrastructure. In the college level, this wasn't as significant of an issue, but in like the K through 12, there are lots of students who are living in lower income households or in poverty that didn't have access to high-speed internet and couldn't complete their classes because they were not able to access the materials. So we need to really step up and support the infrastructure growth in terms of making sure everyone has access to the resources they need in this growing digital economy. Because as our fellow panelists have discussed, this is not over. This is not the end. And so making sure everyone has equal resources to be successful in this time will be really important.
Great, thanks, Professor Hill. Thank you, panelists, for your perspectives about moving forward. We're running short on time, but I want to take an opportunity to engage in a little bit of conversation in the remaining minutes that we have here. As I reflect on your comments this evening, one of the things that strikes me is that it seems that we as a society are very eager to return to, quote, normal, right? And there are definitely some economic benefits of doing so. There are definitely psychological benefits of returning to arts institutions, to visiting national parks, all of these things. And there are definitely some political benefits of opening things back up as well. But as we reflect on the microbiological or public health perspectives, doing that too quickly could be problematic and could really set us back. So perhaps we could reflect for a moment on the conflict that we see here about needing to return to normal, but perhaps the negatives associated with doing that. Thoughts, panelists? Yes, please.
I think that we're very close to near normal. I mean, we have really, this pandemic has disrupted many things early on, but we're pretty much close to normal. Businesses are open, schools are open. The risks, I think, have diminished because, again, we've got a large older population that's been vaccinated. And the question is, again, can we continue on this without seeing other spikes and severe epidemic or spikes in the disease? And I think we will continue to have that. But I guess I wanted to talk about one real quick thing too, and if this is going to be a discourse too, is also that I think it was Mary that pointed out that that we were unprepared. And I disagree. We were prepared. There were people who knew about this. We knew enough about airborne transmission diseases like COVID, and we've had experience with that. But the question is, how do we get the people in power that make those decisions to listen to the scientists? And in the future, and how do we move forward then? How do we base, and it's a risk calculation. What are the risks of opening up businesses? And we are largely open, but when do we begin to shut those down if we do see another spike in cases? And that's where I think the difficulty is going to be, or a new variant. And again, I mean, it will be difficult to go back to some of the harder measures that we need to if we want to, again, prevent overwhelming our healthcare system.
Great. Yes, Maren.
Thinking about this thinking about individual capacity for the pandemic and where we're at and a need to return to normal, I find it very useful to think of it in terms of internet bandwidth. We as humans only have a certain amount of bandwidth or a certain amount of reserves, or thinking of it like a charged battery is also useful. We can only put it so many places. I think one of the problems that we're facing is we're all at the end of our bandwidth for the chaos of this crisis. I loved the analogy or metaphor of the crisis on a treadmill. It was fantastic. So we have to find a way to resume some normalcy in life while minimizing the deadly impact and the health crisis that we have. It seems as though if we trust the science, we can resume a pretty normal life. All we have to do is wear a mask and get vaccinated, and we can resume a pretty normal life and begin to recharge that bandwidth.
Other thoughts, panelists? Yeah, Dr. Gold.
And so I absolutely agree. I think we can return to our normal activities. And I think we have been. People have been going to the national parks. We've been spending a lot of time. We've had beautiful weather lately. And it's been helpful to me. My mental health has been very stressed lately. But being able to get out and kind of resume normal activities has been very beneficial to me. But my concern is that we have been getting a little bit lazy again in face mask wearing and vaccinations and so forth. And as we're starting to get into colder weather, we're going to start moving indoors more. This is the traditional flu season where, you know, respiratory diseases are starting to spread even a little bit higher rates. And I think we're going to start seeing some spikes again. We can't let down our guard. We have to keep up with these very simple practices.
Other thoughts from any of the other panelists?
It seemed like at one point, really before Delta, some of the local governments around the country were trying to rush things back to normal and really kind of reward people for getting vaccinated. And so they started taking away the mask mandates as a reward. But the problem with that, again, is that norms are socially contagious. So if you say to people that, well, if you're vaccinated, you don't need to wear a mask. Problem with that is there's still a lot of people who are not vaccinated, and when they go to a public setting and they see 80% of people without a mask, they're going to be really tempted not to wear a mask too. And I mean, I see that every single day on campus. You know, social norms are powerful. We feel the peer pressure. We feel the expectation of what's normal, what we should be doing. So,
yeah, I would agree. Maybe one last question, panelists. I heard the term empathy used over and over in your opening comments. And I think that this COVID pandemic has really been a case study, if you will, for our lack of empathy as individuals. How do we overcome this? How do we develop more empathy as individuals, as societies, as nations? And how might that help us to move forward from this place where we currently find ourselves? Professor Hershey.
Yes. So I was lucky enough to go with some of the faculty on campus on a river trip down the San Juan River. I hope many of you will get that opportunity as well. About one of the few safety rules that I still remember being given by the guide on that river trip was to remember that we have to be very thoughtful about our individual decisions, because an individual decision can quickly become a group decision. I really think that is the bottom line of developing and maintaining empathy, is to remember everything I do has ripple effects. And even regardless of how hard I try to convince myself that my decisions only affect me, that is absolutely not true, especially in the middle of a pandemic.
Other thoughts?
I think we can never deny our feelings. I think so much of this is that we become numb. We're numb to what statistics are, what they really mean. And when it started that each of those numbers are a person that we have lost through this pandemic, and the numb. And I think we're just really, really tired. I see it in our students. I see it in our faculty. And I think those two combinations of the loss of emotion and the depth of feeling because of being numb, as well as the, just the fatigue, kind of takes us into a position where empathy is a big charge when you're feeling those two things. So we've just got to be able to pull back to how we feel and be honest with our feelings and let us feel.
Please, Professor Reddy.
one of the underreported stories, again, I think in the pandemic, and it's kind of strange when you think about it, is the stories that might fall under the category of survivor guilt. how are you going to feel if you accidentally give a relative COVID and they develop long COVID or they pass away? I mean, have you thought about that? I mean, it's kind of flown under the radar. And I think there's a cultural lag time with a lot of this stuff. It's just hard for us to wrap our head around all these things that are going on. But I think that's one of the big underreported things to think about. And there have been a couple and they interviewed the people who evidently gave COVID to an elderly parent and they passed away. And it's hard to live with that, but we've kind of just ignored that piece of it, it seems to me.
Yeah. Oh, please, Mary.
One thought I have is this will be an interesting thing to watch for in the 22 elections. Empathy is traditionally a very desired quality in a political candidate, and those who are authentic about it are very good at winning. It will be, but as Dee Mendini referred to our deadness and our dullness on our emotional level, other emotions have taken over. Fear and anger, those are emotions that have grown as we've become dulled to the impact of all the deaths. So it will be interesting to see in the 22 elections if we have candidates who are more empathetic and if they are elected, or if their candidates with less empathy are elected because it speaks to the fear and the anger of what we're feeling.
Yeah. Ladies and gentlemen, we're out of time. Please join with me in thanking our panelists this evening for their perspectives. I'm going to turn just a couple of minutes over to Provost Anderson to conclude our evening. Provost Anderson.
Let's also take a minute to thank Dr. Hayborn for facilitating our conversation this evening. Excellent job, and thank you to your panelists. And I hope you noticed, I didn't see any eye rolling, no staring each other down, no yelling and screaming or pounding on the table or chairs they're next to. I do fundamentally believe if we can set aside our own worries and concerns, we can have honest dialogue with people and have greater understanding. We live at a time where that's incredibly challenging for two reasons. The information we get is a result of algorithms which we don't control. We're continually refed through our news cycles, similar stories to what we've read in the past. Be very aware of that. This is called the echo chamber, in which stories continue to reinforce a narrative we read once. Be aware of that. My invitation to you as we conclude this first forum on civil discourse is for you to go find someone who you disagree with. And before you yell them down, or before you tell them they don't understand, sit down and try to understand their perspective. Why do they believe what they do? What led them to those conclusions? And how can you have a civil dialogue with them that will lead both of you to a place of empathy and shared understanding? Hopefully, if all of us do that, we can start to spread, as Dr. Eddy talked about, this idea that there's a lot of things that we're influenced by those who are close to, including happiness. And hopefully compassion and understanding will spread the same way. So thank you so much for joining us this evening. And thank you again, panelists. And we look forward to the next one this spring. Y'all have a good evening.